Good morning, everyone. Firstly, I'd like to extend my warm regards to all the delegates, resource person, and also the members for organizing this conference. And also, I'd like to express my best wishes to all the participants and also to the audience. I am T. Pushyamitra. I'm a BPT internee from Venkatapadmavati College of Physiotherapy, Tirupati, Andhra Pradesh, India. My presentation will be on the effectiveness of sustained natural apophyseal glides, snacks on neck pain and active range of motion in subjects presenting with the neck pain. The aim of the study is to evaluate the effectiveness of sustained natural apophyseal glides, snacks on neck pain and active range of motion in subjects with neck pain. Coming to the objectives of the study, to analyze effectiveness of snacks with isometrics on reducing pain and increasing range of motion in patients with neck pain, and also to analyze effectiveness of general manual cervical mobilization exercises with isometrics on reducing pain and increasing range of motion in patients with neck pain, and to compare the effectiveness of snacks versus general manual cervical mobilizations in reducing pain and improving range of motion in patients with neck pain. And coming to the hypothesis, firstly we'll discuss about the null hypothesis. There is no significant difference in effectiveness of sustained natural apophyseal glides snacks technique along with isometrics in comparison with a control group on reducing pain and in increasing range of motion in patients with neck pain. An alternative hypothesis, there is a significant difference between in effectiveness of sustained natural apophyseal glides technique along with isometrics in comparison with a control group on reducing pain and an increasing range of motion in patients with neck pain. Design of the study, it's obviously an experimental study design. And coming to the study setting, it is Sri Venkateswara Ramnarayan Ruya Government General Hospital, Tirupati, and WIMS Physiotherapy Outpatient Department, Narsingapur. Study duration, it is a 4 times per week up to 6 weeks. And coming to the sample size, 30 subjects are taken and divided 15 in each group. And regarding the selection criteria, firstly the inclusion criteria. Age group between 25 to 35 years with both the genders and subjects with neck pain of less than 3 months duration. Exclusion criteria, contraindication to manual therapy. For example, any inflammatory disease, cervical spine infection, marked osteoporosis, cervical spine cancer, pregnant woman, and fracture, previous surgery of a cervical spine, spinal pathology including IVDP, herniated disc, TB spine, rheumatoid arthritis, vertigo, malignancy, and also vertebro-basilar insufficiency, neurological problem, and psychological disorder. Intervention. 30 subjects with neck pain were selected for the study and randomly divided into two groups. Group A, 15 members. Sustained natural apophyseal glides and isometric exercises were given. And coming to the group B with 15 members, general manual cervical mobilization exercises along with isometric exercises are given. And regarding the outcome measures, visual analog scale is used for pain assessment and universal goniometer for assessing the range of motion in the subjects. Coming to the data analysis, evaluation of outcome variables in experimental group. Graph 1 which shows an experimental group VAS score and graph 2 which shows goniometer values of experimental group. Graph 1 and 2 shows that Group A showed statistically significant difference in pre and post-treatment scores of VAS at a p-value of less than 0.0001 and a range of motion at a p-value of less than 0.0001. Evaluation of outcome variables in control group B. The graph 3 shows control group VAS score and graph 4 shows goniometer values of control group. So graphs 3 and 4 shows that group B showed statistically significant difference in pre and post treatment scores of VAS at a p-value of less than 0.0001 and a range of motion at a p-value of less than 0.0001. Graph 5 depicts comparison of outcome variables values between two groups A and B. And graph 6 depicts goniometer values on both experimental and control groups. So graphs 5 and 6 shows that there is a significant difference in experimental group when compared to control group in VAS and in goniometer range of motion. Hence, experimental group has a slight improvement than control group. Coming to the results of the study, individually each group showed significant improvement in the pre and post VAS and range of motion values. There was significant difference in the delta values of VAS and goniometer in both the groups. Group A, which received sustained natural apophyseal glides, snacks, along with isometrics, showed slight improvement from baseline treatment to last session of the treatment on VAS and goniometer respectively. And Group B, which received general manual cervical mobilizations along with isometrics, showed improvement from baseline treatment to last session of treatment on VAS and goniometer. The difference in delta values of VAS and goniometer showed that Group A showed more significant reduction in pain and increase in range of motion with p-value of less than 0.0001. And finally, the conclusion of the study. From this study, it is shown that sustained natural apophyseal glides combined with isometrics has brought about a slight significant improvement in experimental group when compared to control group in reducing pain and increasing a range of motion of patients with neck pain. Therefore, it can be concluded that the sustained natural apophyseal glides combined with isometrics can be used as an effective means of treatment in patients with neck pain. And lastly, I'd like to conclude this presentation by expressing my heartfelt thanks to Mr. Kamesh sir, MPT Neurology, and Ms. C. Reshma ma'am, MPT Orthopedics, and all my friends and staff at Venkata Padmavati College of Physiotherapy for making this possible. Thank you, everyone.